HIV is a virus that attacks the immune system, our body's natural defense against illness. Testing regularly for HIV means you can get antiviral treatment if you need it and avoid reaching to late stage of disease called AIDS. There are 3 stages of HIV infection. The symptoms vary in type and severity from person to person. Stage 1, acute primary infection. This stage starts with all flu-like symptoms. Stage 2, the asymptomatic stage. At this stage, patient can often start to feel better from symptoms of stage 1. In fact, HIV may not cause any other symptoms for up to 10 or even 15 years at stage 2. Stage 3, symptomatic HIV infection. This is where person's immune system is severely damaged and patient can face life-threatening infections. Today we are listing the very early symptoms of HIV that you might face. Headache and fatigue. The inflammatory response generated by your immune system can cause you to feel tired and lethargic. Sometimes it can make you feel winded while walking or generally feel out of breath. Fatigue can be both an early and later symptom of HIV. Fever. At this point, the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, your immune system induces an inflammatory reaction which manifests as high temperature. Muscle and joint pain and swollen lymph nodes. Lymph nodes are part of your body's immune system and protect your blood by getting rid of bacteria and viruses. They tend to get inflamed when there's an infection. Many of them are located in your armpit, groin and neck, which can result in aches and pains in these areas. Sore throat and persisting dry cough. A severe dry cough that can last for weeks to months without seeming to resolve, even with antibiotics and inhalers, is a typical symptom in very ill HIV patients. Sweating overnight. Many people will get night sweats during the early stages of HIV. These can be even more common later in infection and aren't related to exercise or the temperature of the room. Nausea and diarrhea. Many people experience digestive system problems as a symptom of the early stages of HIV. However, nausea and diarrhea can also appear in later stages of infection, usually as the result of an opportunistic infection. Skin rash. Skin rashes can occur early or late in the course of HIV seroconversion. In some cases, the rash can appear similar to boils with itchy, pink breakouts. With such a vast array of symptoms, HIV testing is vital to ensure a proper diagnosis. If you think you've been exposed to HIV, regardless of whether you are showing symptoms of HIV or not, it's important to get tested as soon as possible. The earlier you're diagnosed with HIV and start treatment, the better your long-term health would be. Thank you for watching. If you liked this video, please subscribe to our channel for more tips.